whatever it's at. Okay, so Dr. Buford, we're just getting started on the right shoulder. We're looking in from the back to the front. Everything that you see is magnified about 30 or 40 times on the screen. And we'll just walk our way through our initial exam here. This is a blue cannula coming in the front of the shoulder called a dry dock, and to the left of that we have a little kind of placer needle. It's a spinal needle, and ultimately we're going to be putting the camera right there. To the left of that is your biceps tendon, and the tendon looks great as it exits the top of the screen outside the joint, but down here we've got some fraying, so we're going to have to decide if this is something that needs to be repaired. Give me a little more slack on it, just a little bit. Yeah, great. Okay, so we're going to put in a shaver, and with a little bit of suction here, it's good. We can clean up that edge and then see if the actual anchor itself is loose. Okay, so now we've cleaned up the edge. And then we'll have to assess that. It looks like we are going to be placing an anchor down there. Hold the camera here now. So 2 hands on it, 1 hand on the light cord so you can follow me, keep me in the middle of the screen. And so now we're going to go ahead and just remove a little bit of the cartilage here since we're already looking right at it. This is where we're going to be doing our slap repair with a double loaded anchor. And so what we're doing right now is just removing the cartilage because we have to have a place for this to heal down to. And so as we look in there, we can see that we've exposed the bone a bit. See, the bone is underneath that white cartilage. So we'll go ahead and do a little bit more and show you some more in a minute. Okay, so now we're looking down the front of the shoulder, and we can see you've got, give me the crochet hook, please. We can see you've got, I won't use that for about 30 minutes. You can see you've got a lot going on here. This is the Bankart injury. When the shoulder dislocates over and over again, this tissue becomes loose right here. So we're going to be repairing that. You've lost some cartilage off the anterior lip, but not a lot of bone. But then the bigger injury that concerns me longer term is look at the humeral head here. The humeral head is pretty beat up, and that's why we're doing this procedure called a Remplissage to try and address that aspect of the injury. This is the posterior shoulder right here. So the next step for us is to go ahead and switch positions with the scope. We'll take our spinal needle back in. We're going to leave our scope in right about here like this so we can see the entire shoulder. Your rotator cuff looks good. That's up here at the top of the screen. Take that and get that to her. Okay, so now we've repositioned the camera. This is the area called the Hill-Sachs lesion. This is where we're going to be repairing this infraspinatus part of the rotator cuff into this area right here. We're just, again, just roughening it up. But you've got a pretty sizable defect here from these recurrent dislocations. We'll keep working here, show you some more in a little bit. Okay, so here we've placed our first, and it's our most inferior anchor. It's got 3 sutures. We're probably only going to use 2 from this one, but you can see when I pull on this, look what it does to the humeral head. See how I can pull that humeral head back over the socket? So I'm happy with that. That's very solid. Now we're going to get to work on trying to figure out how to organize some sutures to get the best repair. I got it for a second. Okay, so here you can see we've passed 2 of the sutures from the first anchor in a mattress, kind of an overlapping mattress. Now we're going to place the second anchor in, slightly more superior. And that's going to go right about here. We'll get that done, show you some more in a little bit. Okay, here's the second anchor, and it's got 3 sutures also. We're only going to use 2 of them, just like before. I just want to show you, we got that second anchor in good position here. Okay, hold the camera, please. Okay, so here's what we've got going on. We've got 2 rotator cuff anchors in the humeral head. We've tied 2 mattress sutures from each of the anchors, so that's a total. That's a total of 4. Can weaken it. That's a total of 4, and so we've got 4 mattress sutures, and I'm happy with that. When we pull on them, you can see how that pulls the humeral head back, and so I think that's going to do exactly what we want it to do. Now, we're not going to tie those Remplissage sutures until the very end, and because we did the Remplissage, we don't have to plicate the posterior capsule. That's going to be taken care of by the Remplissage. So now we're going to come around here and look down the front of the shoulder. I'm going to slip back around the biceps tendon like that, and now we're going to take our Liberator rasp and work on the anterior edge of this glenoid to define it so we can then put in some anchors here. So we'll show you some more in a little bit. But this is what we're going to do next. We're just going to free this up, and then we're going to do this, what we call a Bankart reconstruction. Pause. Okay, so here's the anterior Bankart reconstruction. Oh, we're going to go there. That looks good. We've got sutures lined up down the front. You can see how it's hard to see down the front. That's a good sign. That defect you see in the cartilage, we got a little bit covered up, but we can't really bring that tissue all the way onto the glenoid face. So that looks good. Happy with that. And now we're going to go ahead and get to work on the slap lesion. Okay, so we've got a double-loaded anchor past here in front of the biceps tendon, and we're going to take out 3 of these sutures here, just like that, okay? And we'll leave that one for now. But now we're going to go ahead and get to work on passing a stitch around the biceps. Pause. Okay, so we've got the slap lesion repaired, and it looks good. Okay, so you can see we've got a suture behind the biceps, actually on both sides, almost like a pair of suspenders here. You still got this area in the humeral head that's not escaped without injury. You know, you're missing some cartilage here, but for the most part, we've got everything accomplished that we wanted to here. What's left to do is to tie those sutures for the Remplissage. And so I'm going to move the scope back to the front. We'll get these tied, and then we'll get you back to the recovery room. So this will be the end of the video. I may come up one more time and show you if we have room. Sometimes after the Remplissage, it's hard to even see, but I'll show you that in just a minute if we can. If not, this will be the end of the video, and we'll talk to you in just a minute. Bye-bye. Okay, hold on. Okay, so this is the last image I just wanted to show you. We got the sutures tied in the back. We even arranged them so it closed down the posterior portal, and there you can see how that is attached to the humeral head now. And so that has pulled the head back over the socket. I'm happy with that. So good luck to you now, okay? Bye-bye.